Good morning, everyone. It's just really reassuring to see such a packed house this morning to support the symposium today and the launch of the Middle-Aged Men and Suicide Report. So it's Shane and my responsibility to give an outline of the findings and the key recommendations. Really, I'm the token middle-aged man in the duo. Shane has done the bulk of the work, and I really welcome the fact that there's young researchers coming on board now in men's health over the last number of years to keep the flow of evidence and research going. That's so instrumental and important to all our work. Before I start, I just want to acknowledge, I suppose, that this has been a difficult and challenging report to put together. As John has said, suicide is something that impacts on all our lives. There's very few people in the room that haven't, experienced a loved one of either close or not so close that has taken their own lives by suicide. So there's been a lot of hurt and difficulties caused by suicide in Ireland. I just want to acknowledge that before we start. And it makes the topic very difficult to deal with, but it underlines the importance of the work we're doing as well. And John also talked about that it's all our responsibility. It's not the HSE or it's not the Office of Suicide Prevention on their own. It's a collaborative effort on all our parts. So it is challenging, but it is really, really important work. This report launched today comes on the back of what I think has been a significant body of work that has been produced in Ireland over the last kind of 12 or 14 years. And I've just put in a sample of the reports that have come out. I'm sure there are others that I've missed. And these are just kind of the grey literature. There's lots of obviously papers and presentations and other resources and toolkits that have been published as well. So I think I'm really proud really of the inroads that we've made in terms of grappling with various men's health issues, grappling with the factors that impact on different population groups of men, and trying to translate that in a really useful and worthwhile way into practice and policy and informing in an evidence-based practice in Ireland. So today's report comes on the back of that sort of recent history of an increasing evidence base. Because I remember starting in this work back in 2002, and Biddy O'Neill, is Biddy here? Biddy, Biddy gave me a brief to start looking at what was called a needs analysis of men's health. And Biddy had done a huge amount of work before that with the likes of Alan O'Neill in terms of kick-starting an agenda in men's health. And I continue to tell this story, Biddy, because WHO is here today. Isabel, I'm delighted to welcome Isabel. And WHO is now looking at men's health at a European regional level. And I think it's interesting to chart the kind of history of that and the key role that you and Alan and others played as advocates in putting men's health on the agenda. And I want to really acknowledge your massive contribution in that regard. The context of the report is John has alluded already. We know that men in Ireland have higher suicide rates. What we've seen at the onset of the economic recession and increasing unemployment rates was that suicide rates went up, and this is borne out by lots of international evidence. So from 2007 up to about 2012, there was an increase in suicide rates. But what was really pronounced was that the increase was most significant amongst middle-aged men. And even though the rates have dropped since then, and the 2006 data is provisional, so we can't say too much definitively on that yet, the rates are still highest among middle-aged men. So those of us working in the area are and were concerned about this, and that prompted the report in the first instance. The peak, as I said, was in 2012, and it's dropped back a little bit since then. As John said, by European standards, the suicide rates among middle-aged men are roughly, they're slightly above the EU average for middle-aged men, they're below for overall. But what's interesting about this slide really is the higher suicide rates among Eastern European countries. And I think that tells a really interesting story about issues that Jason talked about, issues of disconnection and isolation and breakdown in fabric of communities, all issues that Alan will grapple with in the afternoon in his session. And they tell us a really important story about prioritising actions that we might look at in this country, and looking at population groups of men who are most at risk. We've also seen an increase in deliberate self-harm rates over that same kind of time period, over the last kind of 10 years. And again, there's been a narrowing of the deliberate self-harm rates between men and women over that time period. And again, with the end of recession, if you like, and increasing employment rates, that those figures have dropped off a little bit. But they're still obviously very high. And we know that deliberate self-harm rates don't give a true reflection of the extent of the problem. So a lot of self-harm doesn't necessarily present in emergency hospital units. And this is particularly of concern, because we know for men that self-harm rates are associated with higher lethality, and also there's a higher risk of suicide following self-harm acts in males. So self-harm is an issue that needs particular attention in the context of males. Just to frame the report in the context of WHO's kind of risk factors, they outline them in terms of individual, relationship, health systems and community factors. So a lot of the findings that Shane will present will kind of link into some of these things. And really the challenge for us is to look at how these risk factors, the challenge for us in the report was to look at how these risk factors play out amongst middle-aged men, and how middle age intersects with all sorts of other aspects of identity, like ethnicity, social class, sexual orientation, and other factors. So how does individual, relation, community and health systems factors, how do they play out in the context of that age cohort, and that age cohort, particularly more marginalised groups of middle-aged men. We also looked in the report at kind of protective factors, because it's one thing to highlight what the problems are. It's another issue to focus on what opportunities there are for addressing the issues. So we'll consider the findings in that context as well. So just before I hand over to Shane, the focus of the report was to explore the factors underpinning the high suicide rates amongst middle-aged men at risk of marginalisation in the Republic of Ireland. John has identified those groups already, but they're, for example, gay, transgender men, unemployed men, farmers, separated divorced fathers, to name some. And the purpose of doing this was to provide more effective and gender-specific programs, services and resources that support their mental health and well-being. So I come back to this at the end, but there's a lot of really good work happening already under the Healthy Ireland agenda, and the recommendations that I'll talk about at the end will be in that context. So Shane, I'll hand over to you.
So just to add to the acknowledgements, I'd just like to really thank all of the men who gave up their time and who chatted to me about what was going on in their life. So I just wanted to add that in as well. So just to give a quick background in the methods. So we used a qualitative research design using the principles of grounded theory. So basically what that means is theories or explanations were developed which were informed by the views of participants. So we collected our data using focus groups and phone interviews, and we analysed the data using cross-comparative techniques. So basically what that means is me and Noel independently coded transcripts, so coding meaning just assigning a short phrase or a word to what the participants were saying or feeling, and then comparing that and which three themes evolved from. So 34 middle-aged men participated in the study. So in addition to being middle-aged, Connecting for Life, the national strategy to reduce suicide, identifies particular priority groups who face an increased risk. So those are the ones here on the left, and farmers, and then there were 3 additional groups who were identified in the research as also facing a high risk. And a total of 35 service providers participated in the study who had a remit for working with men and mental health. So what do we find? So just a quick overall of the 3 themes now, I'll go into it in more detail. So the first theme, marginalised masculinities, was really the sources of psychological distress for men. The second theme was how men seek support or don't, and how men cope during times of psychological distress. And the third theme relates to how a range of factors which influence men's engagement with services. So just that first theme, marginalised masculinities, as I said, the sources of psychological distress. So really we looked at this through, it really emerged through 3 lenses. What's it like in Ireland? What's it like as a middle-aged man? And what's it like as being part of some of these at-risk groups? So we know Ireland has undergone significant changes in recent times, so most notably the economic recession. So the men talked about the far-reaching impacts this had on their mental health, from unemployment to the desolation of pensions, and what James, a farmer man, said, the death of rural Ireland through mass emigration. So there's also that men talked about this kind of change in role of men in society. I know Brendan talked about kind of more men in looking after the family home and that. And you know, some men found this quite difficult. Alan, a rural isolated man, talked about being kind of caught between these two worlds. So we're the last generation before this huge change out there. So he talked about being caught between the world of his father and the world of his son. So men were kind of clinging on to these more traditional ideologies of stoicism or that breadwinner role, whilst also trying to navigate societal shifts towards more open expression of emotions. So this left some men kind of struggling to adapt and feeling left behind in a way. And Leonard, another rural isolated man, talked about this sort of erosion of the male model in which he grew up in, which kind of dislocated his sense of role in society. And this, we need to think as well, this all occurred at a time where the key patriarchal pillars of church and state are kind of unravelling around middle-aged men. So there's a number of challenging transitions that occur at middle age. So we know unemployment and financial strain is associated with suicide, particularly in men. So this has the potential to kind of undermine that provider role in men and can impact their sense of identity and purpose. But what's unique to middle-aged men is that sense of purpose is felt more intensely. And there's this kind of increased responsibilities. This increased responsibilities associated with the provider role for middle-aged men. So there's bills, there's mortgages, there's kids going to college. So there's a huge amount of pressure on middle-aged men, and a failure to meet those responsibilities often resulted in profound feelings of shame and emasculation for men. And one quote that always kind of stood out in my mind was just a small quote from Liam, the traveller man, who talked about this kind of shame he felt from not being able to buy his child the new shoes that all the other kids had. And this kind of provider role felt more intensely amongst traveller men as well. So as well, Brendan talked about men, middle-aged men, you know, not really getting back into employment. And, you know, we found that as well, that men felt that there was fewer employment opportunities existed at middle age. So I think Andrew, an unemployed man, put it, being on the scrap heap before your time. So, you know, this finding really resonated with me, as my own dad became unemployed during the economic recession as a panel beater and has since struggled to get back into employment. You know, I used to share my findings with my dad as I was collecting it, and he used to reflect back to me on similar difficulties he faced. I know that made the findings very real for me. Like, this isn't middle-aged men, this is my dad, these are my colleagues in men's health, and these are all men that we love and care about. So this kind of all coincides with this kind of men felt this expectation or pressure to succeed, as Jason talked about as well. So men felt that there was these milestones that had to reach by middle age: a house, a family, a steady employment. So when these bedrocks were disrupted, it didn't just impact men's mental health, but more in a more deep-rooted sense of feeling like you're going backwards in life. And then what people will consider this kind of term midlife crisis. So this kind of reflection period for middle-aged men and thinking, you know, what's it all about? So men were kind of asking themselves, you know, have I made the right life choices past? Have I achieved enough present? And can I still achieve future? So Dermot, a gay man, kind of talked about, you know, you're kind of in that future and it hasn't happened the way you expected. And it's sort of this recalibration between optimism and realism. There's also these kind of physical changes that happen in men at middle life, you know, and your body is a big way you feel like a man. So when a deteriorating body, when your body starts to go through these physical changes, it has the potential to undermine men's sense of masculinity. So men kind of talked about, you know, I can't do things around the house like I used to be able to do. And also, as Jason kind of touched on earlier, the loss of loved ones at this age was also a significant source of distress. A lot of men as well talked about feeling on the margins of society or not feeling wanted. And this was as a result of what we termed rejection, withdrawal and isolation. So rejection manifested in terms of discrimination. Men felt that they were being discriminated against based on aspects of their identity. So this was primarily for transgender men, traveller men, gay men, victims of domestic violence and non-national Irish men. So the men talked about, being the victims of physical abuse or being victims of derogatory name calling, being refused entry to premises, or given unfair social or employment opportunities. So Joe, the traveller man, I remember talking to Joe and he said, I walk into her pub and I just get refused. I feel that small. I feel like scum. And Joe kind of went on to say, he goes, Shane, sometimes I just feel like I'm better off on my own. And this kind of relates back to that sense of men withdrawn from society. And again, touching what Jason said, his friends were calling him and he was kind of not answering the phone. Which is as well, a lot of men who were going through mental health difficulties were talking about this kind of withdrawal from society. So as you can imagine, with this rejection and withdrawal, there was huge amounts of isolation amongst these groups as well. But there was huge amounts of isolation for all of the groups of men that we interviewed. So it was perceived that there's kind of this narrowing of your social circles at middle age. So at an earlier stage in life, if these increase in work responsibilities, you're raising young kids. So then when you get to middle age, suddenly you realise the kids are moved on and your social circles are after narrowing. And as James, the fireman, put as well, he said, it doesn't take very long for the phone to stop ringing. So there was also this perceived lack of social outlets for men, or for middle-aged men, particularly in rural Ireland, again, which was touched on earlier. Isolation was more about just this lack of social contact and lack of social outlets. It was this kind of feeling of just being alone. Simon, a divorced man, kind of talked about this multifaceted isolation that he felt. Isolation as a result of the breakdown of his marriage, his kids growing up, and because of his unemployment. Simon said, if you don't have that social interaction, sometimes you think, what's the point of being here? So, when we step back and look at that, there's a lot of things going on there for middle-aged men, and they're happening all at once. It can be quite, for me, collecting the data was quite overwhelming as well. It all has this kind of multiplicative and cumulative effects. So support seeking and coping mechanism related to how men sought support or didn't or coped during times of distress. So when I was thinking about, how could I represent this in an image, I kind of thought of that yin and yang symbol used in Chinese philosophy, not in the sense of balance, but more in the sense of that idea of duality. So fire and ice, darkness and light, unsupportive and supportive factors for mental health. So I think the key point here is, it's not all bad news, as sometimes we hear. Men do engage in self-care. If you read the report and read the personal biography of Jack, he talks about this range of things he engaged with, from sleep hygiene to practicing gratitude. I don't know if you saw it on the news a couple of weeks ago, but there was this farmer group in Kerry, in rural Kerry, who engaged in yoga. I thought that was brilliant. So I think we have to give men a bit of credit here as well. Men are engaging in both sides, and we need to highlight the negative impacts of some of these more unsupportive behaviours, but we also need to continue to signpost and provide opportunities for men to engage in self-care, even when we think there's no way they're going to do that. So just to touch on some of the barriers for support seeking for men, so I suppose the most obvious one's the stigma of mental health and the stigma of men seeking support. So on the one hand, men kind of felt this shame for experiencing for experiencing mental health difficulties, and on the other hand, felt this kind of sense of failure for not being able to deal with the problems on their own. So Oscar, a transgender man, put it, sometimes it's not like a stitch in time saves 9. Sometimes you wait till the whole thing's ripped to shreds. Why? Because, these are things you hear your whole life. I remember Paul, an unemployed man as well, talking to me about, he just felt this kind of sense of burdensomeness on his family. And again, this sense of isolation for not being able to share that with his family. But Paul also said, these aren't things that men accept easily. These stereotypes, men constantly grapple with them. And he said, in his experience, men have no problem talking, and that education is a huge thing. And I think we need to highlight that here. It's really important to challenge these stereotypes amongst middle-aged men and in society as well. There's some good work done by John Olaf, which showed that reframing help-seeking as a strength has been promising for interrupting the suicidal process in men. GPs also talk. GPs or the GP was the first port of call for men if they were experiencing mental health difficulties. And the GPs talked about the kind of alarm bells going off if they seen a man presenting, middle-aged man presenting that they hadn't seen in years, and suddenly he's presenting with a minor ailment that he wouldn't usually come in for. But Con and Nathaniel, two GPs I was talking to, talked about, you know, they're so overstretched at times. Sometimes they're often forced to present a treating issue and don't get to talk about mental health, when sometimes they know that's the reason for attendance. And overstretched services in general resulting in poor experience and poor access to services was another barrier for men. So moving on to unhelpful and helpful coping mechanisms. So, you know, we kind of touched on this kind of suppression of emotion earlier, and alcohol misuse. So alcohol misuse was talked about a lot amongst the traveller men, and Joe said to me, you know, 95% of my issues are because of alcohol. He said drink is a substitute that makes you feel good, takes you away from the dark place for a couple of hours, but you know, that doesn't last very long. Some helpful coping mechanisms that men talked about was connecting in with others, like friends or family, or connecting with organised support groups. So the unemployed group, I remember I had a good chat about this with the unemployed group who engaged in this kind of 12-week activity-based program. And I always remember Colin talking to me about this sense of belonging and sense of solidarity he felt with sharing his experiences with men in similar situations to himself. And he said to me, Shane, you know, this just makes me feel normal when a lot of the times I don't feel normal. And Jack from that group as well said, you know, for a group of men, the love and the strength in the room was so intense. And I just thought that was a really powerful quote, which kind of represented that solidarity. So I think so just moving on then, the final theme, negotiating the dynamics of engagement with middle-aged men. So these are the influences on men's engagement with services. So the thing here as well, service providers are doing great things, but there's a lot of challenges that get thrown up as well. So this is just broken down into 3 levels: the interpersonal level, the service level, and the systemic level. So the first level there just relates to the relationship between a man and between a service provider as the individual. So, you know, finding a way into conversations was felt to be a critical skill at this level. So Kira talked about, you know, getting the tea on, beginning with sports and the weather, not just launching into a conversation about mental health. You know, and I don't think any of us here would feel too comfortable about just launching into a conversation about our mental health. And I felt that quote was very relatable, you know, for us Irish people, or, you know, the cup of tea and having a chat. Establishing strong relationships with men at this level also hinged on establishing trust and rapport. So, you know, being truthful and honest with men about what can realistically be delivered, and sharing vulnerabilities with men where appropriate was also felt, you know, to be good at building this relationship with men. So at the service dynamic level, this related to men's relationship with services and services' relationships with each other. So, you know, what we found here is largely congruent with the wider literature on the best practice of engaging men. So, you know, the importance of the informal environment, safe, comfortable, familiar environments for men, which tended to yield better results for engagement. As well, giving men particularly for middle-aged men, giving men ownership over the process, you know, allowing men to develop solutions to their own problems was felt to be particularly important. So there's just a quote here by Paul, who engaged in that 12-week program that we're talking about, and he said, you know, there was this flexibility and an ownership to it. Can you imagine being part of a program where you felt, sure, we ran this ourselves, we thought we were the great lads? And another thing as well is just kind of finding that hook for men, so offering something to men which they value or which they are passionate about. So some good examples of this that came up were walking groups, DIY or craft activities, and learning musical instrument. So I remember Mark, a community-based service provider, telling me, he said, you know, learning the instrument becomes incidental over time, and the real reason men stay is because of their social connection. Just to touch on, there was service providers also felt that they could do better with sharing and collaborating with other services. You know, they felt that sometimes there might have been this fear to collaborate with other services out of fear of losing funding, and so just to highlight that as well. And at the systemic dynamics level, just related to how men services and service providers sit within the wider societal structure and society. So we already touched on the stigma of mental health and men seeking help, but service providers felt that there was sort of this disconnect between the best practice approaches of engaging men and the modus operandi of their funders. So for example, giving men ownership of the process becomes very difficult when you have to deliver against a predetermined set of outcomes where priorities and budgets are already set. It was also felt that there was an undervaluation of soft outcomes, so like connectedness, self-worth, self-efficacy, and I think we need to change the language around that as well. The language is very important as we use as researchers, and that term so-called soft outcomes. And finally, service providers talked about the difficulty in trying to develop and implement sustainable models of practice when funding operates on a short-term or year-to-year basis. So I'm not going to go through all of this and tight for time, so just to highlight, what Noel talked about, that World Health Organization kind of model of risk factors, when we put that into the previous slide of the strengths and challenges of service providers, we kind of get this engaging middle-aged men in suicide prevention model. So, as John touched on earlier, this isn't about just the individual down here. This is about everybody in this room. This is about members of society who have a part to play in reducing stigma. This is about the policy makers. This is about service providers. So I'll give it back to Noel on that.
Thanks, John. Just to pick up then on what Shane is saying there, I mean, there's definitely no sort of magic formula, or there's no quick fixes in terms of as we look at recommendations and actions coming out of this. And I mean, it's stating the obvious, but the needs, say, of traveller men are very different to the needs of gay or transgender men or isolated rural men. So it was really important for us, and a challenge also, to try and frame the recommendations in a way that kind of plugged into the Connecting for Life policy agenda and the Healthy Ireland agenda, so that we're not starting from scratch, but we're actually working on an existing evidence base and trying to work within that kind of policy landscape. So I'll just go through these quickly. I'm sure you're all needing a break shortly. There's kind of 6 recommendations, broad recommendations in the report that form the acronym ACCESS. The first is in terms of advocacy, and identify and facilitate key advocates to drive the agenda of middle-aged men and suicide and prevention in the Republic of Ireland. So, I mean, the report goes into this in more detail, but there's 2 kind of layers to this. There's a real need for advocates at grassroots level, and we see this happening already, say, in men's sheds, in the GA Healthy Club project, and other kind of community-based activities. So it's really important that, like, as important as it is for, say, Jason McAteer as a high-profile man to talk about in a very personal way today, that's amazing, and it's really laudable. But until we get to the stage where men, ordinary men in pubs or GA clubs or any other setting, are talking in a more natural and spontaneous way about mental health issues, we haven't really gone beyond the stigma that still exists there today. So that's the challenge for all of us. So hence the importance of advocacy. And that advocacy role at grassroots level needs to be enforced at a statutory level, that we have leaders and advocates within the mental health services and beyond that are pushing the agenda that we're talking about here today. The second area talks about connection, and it talks about supporting middle-aged men at risk of marginalisation to build and strengthen relationships with friends, family and service providers. So, I mean, we know what's working really well. I mean, I've seen the evidence on the Larkin Centre programme, and Bench will talk about that afterwards. I was down at a graduation in Clonmel there before Christmas, and just to see the connection between the men in the room on a simple, short programme that lasted for 10 or 12 weeks, it was just a joy to behold. And we see this in sheds as well. We see it, the Men in the Move programme, which is ostensibly a physical activity programme. Ashling's findings are showing incredibly clearly that it's the connection, the forging of strong relationships between the men that's critically important. So this is the single most important challenge for all of us, is to bring men who are in vulnerable situations and who are marginalised for whatever reasons, to support them to form stronger connections and build stronger relationships. The third area of the recommendations is in terms of communication, and this won't be the first report that talks about the need for better integration of services between, say, primary care, mental health and addiction services, and that's an ongoing challenge, but it was really, really highlighted in our report. We also talk about the need for kind of a coordinating function in the statutory level to kind of coordinate the work of different agencies and different groups, which is a bit disparate at the moment. And there's an onus on us after today to get a communications plan out, to get the findings of this report out to those who need to hear it as well. The fourth is in terms of education and training. Yesterday in this room there was a group of engaged trainers that had the last element of a Train the Trainers programme, which has been running now for a while, and this is a really successful evidence-based programme. We've already developed specific modules, for example, on young men and mental health, and there's huge scope here now, building on the support of the National Office for Suicide Prevention into years 2 and 3, to develop another training unit that supports service providers to engage more effectively with middle-aged men and to provide extra resources and toolkits to support them in that endeavour. Stigma reduction and awareness is obviously hugely important, and I'd just like to acknowledge the important roles, for example, the Little Things campaign has played in challenging stigma and making it more acceptable and normal to seek help and access supports. And I think there's potential there for us to work with the National Office for Suicide Prevention to maybe to tailor that campaign in the future, to have a focus on middle-aged men and to challenge that stigma and improve awareness of mental health issues. And finally is the issue of support. Shane talked about the importance of the so-called soft outcomes, but a lot of service providers that Shane talked to emphasise the importance of soft outcomes, supporting men in terms of building their confidence, their self-efficacy, their self-care essentially. And really that's the kind of level of support that we need, and we need obviously increased services and community programmes to support men in that endeavour. So just that's the recommendations. Just to sum up really, it has been, as I said, a challenging report. The findings are challenging. It would be wrong to think that it's an easy fix. Suicide is a complex issue. The issues with middle-aged men are multifaceted, as Shane has outlined there. So there's issues to do with middle age and issues to do with different aspects of identity associated with middle-aged men. So if we're really going to address the issues, we need to grapple with that kind of complexity and look at several different avenues as a way in to broach the issue. So it is a challenging road ahead, and really the buck stops with all of us. Thank you very much.